Basement, finished papers, or third. Yeah. Yeah, I know. Because next week is the 31st. Yeah.
Why are there people that come down the street and find that they are and I can get both of this house. But you know, you heard me say this 100 times. I could have as soon as that car. You'll not get the money.
I think it's your attitude.
I'm happy. I know it wasn't my overwhelming personality, but it's the truth. I mean, you know, there's prestige people that
Yeah, I promise. He's got to do batting with him. He's got to win something. Before the fifth precinct, he got the deer vote. They came across the river, past the park, and then up in line. Back the other side, he said he saw a deer swimming out the island. I think they're probably out back of the island.
worse than any man.
Good evening. Would you please stand with me for the invocation and pledge of allegiance? Councilman Rogers.
Let us pray. Our God, our Father in heaven, we thank you for this day. We thank you for all the blessings you've given to each of us. We pray tonight that you will be with us and guide us as we go about the business tonight and as we start our budget process. We continue to pray for those serving the armed forces abroad and serving in harm's way. Be with them, guard them, protect them, help them return home safe. These things we pray in Christ's name, and amen.
Amen. Councilman Conley, please.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
We have two people that have signed up this evening for the public forum. So, Henry, if you'll go first, please.
Test. Okay, it works. Henry Sasson, up in Greenmont Hills. I only have one topic today, and I had something initial, but I dropped it, and I brought this one here today because it's a little bit humorous, and I figure everybody needs a little humor. I was working from the home office today, and 11:29, I get a phone call. I look at the house phone and it says City of Vienna. So I'm thinking, this is kind of odd. I says, I never get a call from the City of Vienna. I says, maybe Mayor Rapp's inviting me to lunch. Well, lo and behold, I answer the phone. It wasn't Mayor Rapp. It was a telemarketer using the City of Vienna, call name. So I called down to the city building. I informed the lady. I told her to pass the message on to you that we may have an issue that somebody's going to have to address. So here is the picture I took from the phone, from the house phone, and the phone number.
So did you want a vacation, or were they trying to help you?
They were trying to sell me something.
Okay.
I don't know if we got to do something as a city to stop something like that or not.
Chief Piper, we've talked about these things before. To be honest with you, Henry, I had a phone call from my own phone to myself the other day.
I had that too.
It's crazy.
That's all I had.
All right, thank you.
Yeah.
Kim Williams.
Hi. Well, that's a little tough to follow, Henry. I don't have an exciting story like that, but I was here a couple weeks ago and we were talking about health insurance. And I brought up that I felt that our city, we're a little out of line than other cities. And the cost sharing part of it, we have a cost sharing about 93 to 96%, whereas other cities, and including the state, it's around 80 to 20%. And when I was here, I mentioned that Parkersburg insures all their employees for about $45,000 more than what we insure our employees for. But the problem is they have 260 employees. We only have 80 employees. So why is that different? The reason that it's different is Parkersburg has PEIA insurance, which PEIA insurance is available for non-state agencies like cities and municipalities like Vienna. Okay, I'm not talking about PEIA insurance for the teachers. That's one track that they have, but they have a non-state agency track. That's what I'm talking about. So they have different plans, plan A, B, C, and D, and employees can pick from those plans. But if you take plan B, which has the lower premiums but a higher deductible, under plan B, the family plan, not everybody would want to be on the family plan, but just for this example, if we picked up family plan and all 81 employees were on the family plan, their premiums would be $1,022 per month, and the deductible would be reduced from $2,000 to $1,450. If we applied an 80-20 cost sharing, okay, then that means the employees would pay an additional $80 per month for their insurance, where they pay about $125 now, they would bump up to $205. But what it does on our end, on the city's end, is we save $480,000 a year. That's $480,000. So that means, more roads, better streets, maybe better activities for the youth, seniors, maybe even get rid of that $215,000 police fee that was such a contentious part of last year's budget. So I just feel like there's a process which is kind of opaque, because we have a situation where the mayor, the department heads, and then the finance director look at these plans, and it's like we need to get to where the council is looking at the plans and making the decisions. The council is the one who approves the checkbook, the expenditures. And then what ends up happening, because the mayor says, obviously it's very hard there's a lot of risk in the insurance, and so if you have a catastrophic thing where somebody gets diagnosed with cancer, or you have a premature baby, or somebody's on dialysis or something, it causes those rates to go up. That makes complete sense. But the thing with PEIA, because it's such a big pool and the discount is so great, that they're pretty stable. In the last 4 years, the insurance premiums on Plan B have only gone up $50, okay? So whereas, and we have to wait to the last minute, it's the last piece of the puzzle that goes into this insurance plan, and it's kind of like council can't really negotiate at that point, because in this last budget was $1.27 million. The council can't come back and say, well, Mayor, I'm only going to give you $800,000 or $900,000. We're right at the edge, so there's no really new approval from the council. They kind of just have to do it. So what I'm suggesting is we rethink this, look at something like PEIA, look at a lower cost sharing, and start saving some money. Because, that's serious money when you start talking about, the insurance would be less than $800,000 for us to insure 81 employees. So, thank you.
At our last council meeting, we had a discussion about insurance, and so this evening, Mr. Mark Schwindeman is here to give a in-depth explanation of the process of how we look at our insurance plan. So, Mark, if you step up and educate us, please.
Thank you, Mayor. Thank you, Council. Appreciate the opportunity to address the council and the public concerning the City of Vienna's health insurance. Probably would help if I passed out a handout kind of get us started in that discussion. So let me just do that as I approach the
Thank you.
Okay.
Mark, if I could stop you for just a minute.
Sure.
Adam, would you turn the Elmo on, please? Mark, do you have another copy, or I'll give him mine if you don't?
Oh, great. Thank you. Yeah, I've got another one right here. We're good. Okay, thank you. Okay, great, thanks. Okay, so let me, if I could get started. First of all, I thought it might help just to give a little background on our firm, the Schwindeman Agency. Been around for a long time, going into our 90th year of operation, which we're quite proud of. But as a general information for the council and the general public, our firm works with about 300 employers in southeastern Ohio, West Virginia, central Ohio, throughout West Virginia and Ohio. We represent our clients, so we're not necessarily tied to any particular insurance carriers or type of funding arrangement with regards to health insurance. We work with all the carriers that are in the marketplace. Our agency has 31 employees, majority of which work in our employee benefits division. We're shareholders in a national firm called United Benefit Advisors. That's important only because of the fact that we have 2 ERISA attorneys on staff that would assist us with our clients. We have some technology applications that are very important for our clients as well. We have access to ERISA attorneys, as I mentioned. We have a compliance specialist on staff. We have a wellness coordinator on staff. We have a plan participant advisory service to help employees and participants with claim resolution and also benefit questions. So that's kind of a general description of our organization. Let me describe the relationship and how it actually got started, if I could, with the city of Vienna. The relationship started in 2011. In August, there was I'll paraphrase this. There's a concern, I believe, with regards to rate increases that the city was receiving on its health insurance. At the time, and we still do, work with Wood County concerning their benefits. There was a recommendation from Wood County to address and actually talk with the city of Vienna, which we did, and fortunately formed a relationship with the city concerning an advisory role or consulting role with regards to the employee benefits, primarily health insurance. Prior to that, at least as we understand it, there was not an advisory role for the city of Vienna. In other words, it wasn't a consultant or broker working on behalf of the city. So the relationship started in 2011. We appreciate that, and we continue to have a good relationship with the city. So I wanted to kind of give that backdrop with regards to our firm and the relationship with the city of Vienna as we move into the services that are provided, and then specifically the process and how it works. The services that we provide for the city, the main one we call our rate containment process, which is a benefits review and shopping process in the marketplace for health insurance. That involves, because of the size of the city with the number of employees, there's roughly 75 to 80 employees in any given year that have health insurance to the city. The majority of those are family arrangements, partially because of this, as the lady mentioned, the cost share associated with the plan. I think it's attractive for city employees to actually have their families covered under the city relationship. So I need to stop just a moment and talk about the term health insurance and over total compensation, because that's really how we ask our employers to look at this. The benefits are one aspect of total compensation. And so some employers, and mostly in the private or public sector, of the 300 employers we work with, about 25% of those are public sector. Interestingly enough, we just helped a public sector company employer come out of PEIA, as was described. And I'll talk briefly about that in just in a few moments concerning the PEIA and actually the total cost associated with PEIA. So it's our rate containment process. So we go through the marketplace analysis, and I'll go again specifically to what we did this past year for the city of Vienna. Also, because of the market size, 75 to 80 employees, you're in a market size in the private insurance marketplace where not a whole lot of claims information is provided, very little is provided. So in order to get competitive pricing from other carriers, we have to confidentially gather information from the plan participants And we do that. We assist the city in doing that. Then to go to the carriers to get pricing for the specific health insurance plans. We negotiate considerably with the insurance carriers with regards to the premium rates and what the actual renewal starts out to be and what it ends up being. And I'll, again, describe that here in just a few moments. Plan design discussions. We make recommendations concerning plan design. We just recently, last few years, implemented a high deductible health insurance plan with a health reimbursement arrangement, or an arrangement whereby part of that deductible is reimbursed to the participants once they've satisfied a portion of that. And that combination has proved to be more cost effective than a lower deductible fully insured plan. We meet with the city's insurance committee periodically throughout the year, then quite frequently through the last few months prior to renewal with regards to what we found in the marketplace in final rate renewals and costs associated with the plan. We coordinate and handle employee meetings with regards to benefits. We have a wellness coordinator on staff, as I mentioned, that actually implements and works with the management of the wellness program here at the City of Vienna, which includes biometric screenings, health risk assessments, and all those types of things. The advocacy services throughout the year, our staff, of our 31 folks, the majority work in our benefits area. They're available for employees to call on their behalf to work as their liaison to the insurance company for claim resolutions, benefit questions, those types of things. And we facilitate the insurance committee meetings throughout the year. So generally, that's our relationship with the city, and it's an ongoing relationship, not just a per event relationship. So let me describe the renewal process, because I think that's, especially as you're starting to go through the budget process, that's obviously what's extremely important. The renewal process begins 5 months prior to the renewal. So we just are starting on that. Your renewal is July 1st. So in January of the year, at the end of January, we start the process. Employers in the 51 to 99 market segment are not eligible for Affordable Care Act plan rates, as are only small employers. The renewals are pool renewals. You're currently covered with Highmark, Blue Cross, and Blue Shield. So Highmark looks at all the employers renewing on July 1st in that 51 to 99 employee segment and attaches to that a rate increase that they feel is commensurate with what the cost will be in the following year. Then each individual employer in that pool is looked at with regards to its loss ratio, paid claims to paid premium, and correspondingly, as compared to the average increase of that entire pool, the rate increase is adjusted for that particular employer. If claims experience is worse than anticipated or worse than expected, the rate increase is greater. If it's better than expected, it's less. We deal with inflation trending, whether it's PEIA, whether it's public employer plan, whether it's individual private sector marketplace plans, ranging anywhere from 9 to 13% over the time period that we've been working with the city. So if you think about that, the rate increases with any health insurance plan, if they're priced appropriately, we'd expect a 9 to 10 or 11% increase per year. The city's not received that. PEIA that the lady mentioned earlier is not unique, and it's not separated from that. I think the thing to be aware of is health insurance finances healthcare costs. Healthcare costs go up considerably. They're expensive. That's why health insurance is so expensive. PEIA's had its fundamental problems as well with regards to financing and funding. If it weren't for the state government providing more money in, and by the way, the cost associated with the city, in all due respect, is considerably greater than what was described, because there's additional cost that the employer pays for this funding of the city's health insurance. You find that out once you try to help somebody get out of the arrangement. So regardless of the financing arrangement, I'll come back to that here in just a moment. But in any event, each year we start the process about 5 months ahead of time. I'm sorry, I should have moved this forward. 5 months ahead of time.
Mark, excuse me a second. Adam, how do I turn the volume up slightly?
Maybe I just speak.
On what, his microphone or what?
Yes, sir.
I'll just speak.
Or all of it, I don't care.
How about I just speak a little louder? Is that better?
It's either that or the microphone needs to be closer.
It might throw off the balance, but we'll try.
Just move the mic closer.
Yeah.
Yeah, probably.
Is that better?
Yes.
Okay, great. Thank you. So anyhow, I'll keep going, and hopefully it's a little better since the mic's a little closer where I am. So in any event, the process where we gather information to go out to the marketplace is different than what you might expect, because in the 51 to 99 employee marketplace, we literally have to gather information concerning health risks associated with the plan participants. That's done extremely confidentially. Only us and The insurance carriers see that. We have a business associate agreement with all of our employers in which we have to do that exercise. So we gather the information, then take that to the marketplace, the carriers that are available. I'll describe those here in just a moment, to do a market shopping process or analysis. What some of the time constraints are is that in the past, when I say in the past, up until this past year, insurance carriers would only look at applications or medical information 60 days prior to the renewal. And so that pushed the time frame very short in order to get competitive pricing. We would still start the process ahead of time in January, late January and February, gather the information, then if a carrier was competitive and we were seriously considering that carrier, we'd have to have the employees refresh that information prior to the renewal. Fortunately, carriers have moved that out to either 90 days or 120 days, depending on the carrier for that process. So we hope to be able to get the marketplace analysis done a little bit sooner. So if everyone would take just a brief look at the handout, and I know it's a little difficult for the audience to see. This was the time frame and process for 2018 by day, as we had something significant that we did at our firm. So in mid-January, we requested an early renewal from Highmark Blue Cross. It is an early renewal process because the renewal, as I mentioned earlier, is in a block basis, so that typically would happen about 90 days in front of your renewal. So we request that to come out 5 months prior to the renewal. It depends upon when Highmark will get that to us, but last year we actually received the renewal on, it looks to be February 16th. The original rate renewal from Highmark came out at 19.7% increase, significant increase. We had a meeting with the insurance committee here at the City of Vienna. We finalized the applications, went to the marketplace, talked with Cigna, Aetna, the health plan, United Healthcare. Unfortunately, the number of carriers in the private sector in both Ohio and West Virginia has decreased over time, just because of the problems, quite frankly, with making money in the health insurance business, especially with the guaranteed issue atmosphere with the Affordable Care Act. Requested alternative plan designs from Highmark on March 1st, and we recognize the budget process is a tight timeline, and we try to get as much information to our public employers by March 1st, which is when you actually need that information. So we met with the group, the first renewal, and actually we keep continuing to negotiate with Highmark. We got a rate reduction from 19.7 down to 7% as of March 8th. Had further negotiations with Highmark. Actually had some competitive pricing from alternative carriers. Went back to Highmark, and ultimately that renewal was reduced from a 19.7% increase to a 0, no increase on the renewal. And I'll give you a bit of a history with what's taken place throughout the years with regards to that negotiation process. Then the renewal was finalized in April for the July 1st effective date. We had our employee meetings in the subsequent month in May to review that with the employees. So briefly, to summarize the process, it's a process. It's not an event in the health insurance marketplace. We don't necessarily accept the renewal as it comes out. Matter of fact, we hardly ever do. That's one of the advantages I think we've had in the relationship with the city. I believe prior to 2011, there was not a whole lot of ability to negotiate rating with the incumbent carrier. So that by virtue of going to the marketplace, our experience, our team's experience with regards to working through this process, we've actually reduced rate increases considerably over the years for the City of Vienna. So let me move to bullet point number 5 in the handout, and I'll certainly entertain questions if I could. It's at the bottom of the handout. A little hard for the audience to see, but just to give a kind of a summary, we started our relationship of August of 2011. The first renewal that we had an opportunity to work with for the City of Vienna was the July 1st of 2012 renewal. The original increase came out at a 9%. For the same plan design, we were able to negotiate it down to a rate reduction of 4.8%. Rate reduction savings that particular year was about $166,000. Wasn't actually savings. I want everyone to realize that because healthcare costs continue to go up. But this year it was a savings of $166,000. The next year, the rate renewal started at 16.75%. We were able to reduce that to a reduction of 2.53%, $209,000 differential. 7/114 to 6/30/15, 15% increase, reduced to a 0%, $148,000 differential. Then in 2016, actually the renewal came in at a reduction to begin with. was not any further negotiation. We felt it to be fair based on the benefits and the premium that was being paid. 2017 was a tough year. Had a 31% increase right out of the chute. We were able to negotiate that down to 23%, but still a considerable increase. And then this past year started at 19.7 and actually was reduced to a 0%. So over the several years that we've been fortunate enough to work with the city, the renewal rate reduction has been about $900,000, close to $1 million in premium reduction. So when we compare that to without negotiation, it's a considerable savings for the city. Let me comment one other thing, then I'll open it up for questions. Certainly the PEIA is an alternative. Any public employer in the state of West Virginia can go to PEIA. If that's something that is something that wants to be explored by the city, then certainly that can be done. I can tell you there's costs associated with the city for that city with that particular plan that would be significant. But that's something that it's totally up to, obviously, the city and whether or not you want to pursue that. We think that overall in the private sector over time, that you're going to be in a better position with regards to benefits than you would be through PEIA, but that's an opinion, and certainly that's subject to conversation. So summarizing then, and looking at total compensation for the city, you take into account salaries, benefits, and retirement. And so most of our public employers have benefit plans that are a little more rich than private sector employers. We recognize that. Compensation levels, although may not be as significant as private sector employers, so it just depends on how the city would like to handle that. So Mayor and Council, I'll open it up for questions, if I could.
Yeah, Mark, I'd like for you to explain a little bit more, and this touches on what you just mentioned, with respect to the approach of a total compensation plan. Can you elaborate a little bit more on when you're negotiating these rates for the city versus the private sector, what you mean when you talk about a total compensation plan approach to health insurance coverage?
Sure. Thanks, Councilman Leach. Total compensation, we talk with our employers considerably about that. If you think of a pie or a bucket of money, when it comes to employment, there are really three areas that money can be divided upon. One is salaries, obviously. The second one would be benefits, which would be health insurance and the related benefits associated with that. And thirdly would be retirement. What we typically find in the private sector are higher deductible health insurance plans, higher out-of-pocket costs at time of claim, whether it be for major medical services, something such as that. However, what we also see are considerably higher salaries and compensation to offset some of that additional out-of-pocket expense. Retirement is put into that as well when we consider what the overall compensation for any city employee might be as compared to a private sector employer. But specifically, Councilman, the compensation associated with private sector employers is typically greater, and benefit out-of-pocket costs would be greater, including contributions.
Thank you.
Mayor, if we could, because of the tremendous interest we have with the public and the total effect that this insurance has on our budget, I'd like to recommend that we actually open the question and answer up to the people on the floor as well as to council.
No, Roger, we're going to keep this at the council table. So any question from the council members, we'll be glad to answer.
I actually have a few questions, Mark, so I'm just going to keep on going. And so when you talk about the group size of, is it 50 to 99, 51
to 99, right.
So you mentioned the questionnaires that have to be submitted. Mm-hmm. Excuse me, I'm sorry. So how is that different than a larger plan, and what do our employees in the city of Vienna have to go through in order to be able to enter this competitive marketplace? What information do they have to share?
Good question. In the larger employer market, which would be defined as employers with 100 or more employees, we can access claims experience. We can actually see, especially with our self-funded clients, the majority of our public entities are self-funded. Cities fully insured for the right reason because of the size of the group. We can see a lot of information, and the underwriters can see a lot of information. In the state of West Virginia and in the state of Ohio, insurance companies do not have to disclose claims experience, actual paid claims, for employer groups of less than 100 employees, which is a problem when it comes to actually trying to get marketplace quotes. So as an alternative, since we cannot see specific claims experience, which, by the way, that's then utilized to to predict next year what the cost would be for an insured group that has claims experience that we can access.
Including our own specific claims experience.
Well, it would be if you were large enough, right? But right now you're not. So consequently, since we cannot get claims experience, the questionnaires go through, they ask for health history for the employees and all the dependents. For you folks that have had to complete those, you know what I'm talking about. It's done online, it's done confidentially, and then submitted to the insurance carrier. The insurance carriers, then the underwriters will look at the overall risk associated with the group based on the conditions and forecast the rates that would be needed in order to cover cost of care. So the differential is in a large group, we can use actual claims experience that we receive from the group, from the carrier, and we can do that in analysis, and so can the underwriters. In a smaller group like the city of Vienna, you're left with having to gather medical information to predict the cost of the claims associated with those conditions.
So do our employees, by participating in that exercise, help with our rate?
Absolutely. As a matter of fact, I'm glad you made that comment. If it weren't for the city's participation, which we really appreciate, our ability to negotiate rates downward would be very difficult. We would not be able to get competitive marketplace carrier rates, nor would we be able to assess the risk in our office to go back to the incumbent carrier, which is Highmark, to have that negotiation with them. That process over time probably has made up the majority of that $900,000 reduction in total cost.
Can you describe a little bit more about the role that the wellness participation contributes to our rate exposure and experience with the carriers?
Sure.
And the services you offer in that wellness program?
Sure. With the wellness program, we have a doctor actually we created a company with a doctor that manages it, Dr. Darren Swartz. The goal with that, we started that 5 years ago. If you think about it commonsensically, if people take better care of themselves, get their preventive exams as they should on a routine basis, the age, gender appropriate exams, then consequently they would be healthier long-term and be able to stay on path with charting a good course for proper health. We can't tell you exactly how much that's reduced claims costs because we don't know. It's hard to measure what didn't happen, but the city's been robustly involved in that for the last 4 or 5 years, in that meaning the biometric screenings, preventive care, and wellness assessments. Our Dr. Swartz manages that, and manages that in conjunction with the city, so we help coordinate those biometric screenings and health risk assessments. I will tell you that if absent doing that, claims costs are typically higher. In the employer groups, which we can measure where we get claims experience at above 100 employee lives, we can see a pathway of claim differential with those employers, those that are robustly involved in wellness programs as compared to those that are not.
And then I just have one more question. So last year when we were in the committee, you showed us a portal with Highmark that enabled plan participants to go in and actually shop for services. So for example, I saw variances, for example, say a lumbar MRI, which I've had one recently, all right? And those prices can range anywhere from $700 to $3,600. And by virtue of our employees using that portal, does that also help our rate experience by choosing the more competitive service rates that are available in the Mid-Ohio Valley?
It does. So let me if I could take just a moment and describe the process that you just mentioned, Councilman Leach. The majority of insurance carriers now have what we call two specific tools. One is a virtual health visit opportunity where you can actually have a doctor's office visit on your smartphone or on your tablet, and actually for minor types of things. Cost is considerably less. It's $49 for an office visit as compared to maybe $150 to $180 for a primary care or specialist office visit. So the more we can get involved with utilization of those types of tools and control what we can control with regards to cost, then the overall cost is going to be impacted and reduced. The cost estimator tool that you just mentioned, and this is something that typically the general public doesn't really realize until they get involved in the process. Even though a provider, doctor, hospital, outpatient facility is in network for a PPO provider, the cost associated with services can vary drastically. To your point, MRIs, if you put in a 50-mile radius of Parkersburg, West Virginia, Vienna, West Virginia, the price differential for an MRI of the knee will range from about $700 to about $3,500. So by virtue of educating plan participants with regards to those cost differentials, then the lower cost of care, they don't have to always pick the least expensive. That's not where we're going. But being educated and starting to buy health care like we buy anything else, where we ask about cost and quality of care ahead of time before we actually have the service performed, we're gonna see a marked difference in the overall cost of care. Cost of care claims drive premium in the whole pool, and then when City of Vienna is looked at on an individual basis, depending on what that loss ratio is, claims to premium dictates what your rate renewal increase is. Give you one more example of that, which is extreme, but it happened with a lady in our office. We're in Marietta, so right across the river. She needed a hip replacement surgery. We're with Blue Cross Blue Shield. Ohio's different than West Virginia's Blue Cross Blue Shield, but it's the same association. It's Anthem versus Highmark. Used a cost estimator tool. This was 3 years ago. Same surgeon, had admitting privileges in 2 facilities. If she had the hip replacement surgery done on a Tuesday in one facility, as compared to Wednesday in the other facility, the cost of that surgery was $20,000 difference because of the facility charge. So we're going to see a lot more transparency with regards to healthcare costs. Federal government now requires, just as of January 1st, for hospitals to post their prices online. I encourage folks to take a look at that. You'll be amazed at some of the prices associated with conditions and costs. So let me just sum. Any further questions?
I promise that was my last one.
Okay. Tough process. I get it. We work with this day in and day out. Healthcare costs are expensive. Financing healthcare costs are expensive. There's no magic bullet. PEIA has the same costs associated with healthcare plans as other plans. It's just a matter of how they divide it up among the participating employers. Something certainly that can be reviewed. However, it is a process, and it's a different way of handling your health care. That's something, if the council decides to do that, then obviously can make that choice to go that direction and take a look at it. We will continue to do our best on behalf of the city of Vienna in order to contain costs the best that we can. And if we look at our overall costs associated with the plan between now as compared to 2011, the cost increases are much less with us involved than they would have been without us involved, based on what we're seeing in the original cost associated with the plans.
You know, a question.
Sure.
When you talk about going out and shopping for insurances, what's your parameters? Are you given, here's what we had last year, we'd like to have something like this again this year. How does that process work? And then when you do shop around, what do you bring back to this insurance committee? Is there options, or is there just one policy you bring back, or what's that? Explain that to me, please.
Good question. So the process, we start with the incumbent plan, or as close as we can get to that. Carriers on a fully insured basis have to file their plan designs with the State Department of Insurance and get them approved. So in the 51 to 99 market, typically no carrier is going to have the same plan design, no 2 carriers. They'll be close, but they won't necessarily be the same plan design. To give you the best example probably is when we first got involved, the plan design was a very low deductible, $250 deductible plan, 80-20 plan with a $1,250 out-of-pocket cost. Over time, we continued to move that as a recommendation, move that deductible up until today. There's a $4,000 deductible for the health insurance with a health reimbursement arrangement that's kind of a mini self-funded plan that reimburses part of the claims that employees incur when they have those go against the deductible. So it involves a discussion, and quite frankly, it involves the philosophy of the employer. Where do we want to go? Do we want to considerably lower our cost of health care, put more cost at time of claim on out-of-pocket expenses to the participants, and by virtue of doing that, maybe freeing up some money from salaries? Or do we want to keep a level of benefits that's pretty much commensurate with what they've had in the past? So to answer the question, we come back with options and have a discussion through that process as to where the employer, in this case the city, would like to end up with its benefit program.
And that discussion is held with whom within the city?
With the insurance committee,
okay.
Councilman Conlon, with the insurance committee.
And that's the 13 people that we talked about, the committee, that's the one we're talking about, he comes back to have that discussion with, is those 13 individuals?
Yes.
Okay. Question, if you look at the policy that we have today, the one that'll be coming up for renewal, if you look at that total package, the out-of-pocket, the deductible, the $2,000 that the city potentially contributes, the amount of money that the employee actually pays toward their premium. With your expertise, would you call that total package, like a, would you say it's a bronze, a silver, a gold? Where would you rate us at?
As I'm responding to that, let me once again come back to total compensation, then I'll certainly answer the question very specifically. We think it's very difficult to isolate the health insurance plan without talking about total compensation. Because when we do that, I could specifically say, Councilman Connolly, this plan is richer than what we would typically see in the private sector marketplace. Commensurate probably with public sector, maybe just slightly richer than public sector. But then when we look at total compensation or have that discussion, I think we need to take into consideration what the salary levels are and then what the contribution levels are for the participants participating in the plan. If we isolate it and just look at the plan as you've asked me to, I would say it's with regards to benefit design, probably a little richer than what we would see in the public sector. Contributions a little lower, but again, I think it should be taken into consideration with total compensation.
Thank you.
Any other questions? Well, Mark, thank you.
Thank you.
I know that the process will start very shortly. We look forward to your help again this year, and we'll get through it.
Thank you. Appreciate the opportunity.
Thank you.
Thank you.
I'd like to call to order this regular session of the Vienna City Council for January the 29th, 2019. Let the record reflect that I've taken roll that all members of council are present. Having a quorum, we will proceed. There will be no report of the treasurer this evening. It's given at the first meeting of the month, so we will do another report the first meeting in February. On our agenda this evening, we have no unfinished business. The first item on our agenda this evening is a capital expenditure request from the police department for a police software solutions upgrade. Oh, I'm sorry. Thank you. I'm sorry. I missed that. I went right over it. Thank you. Let me back up, please. The minutes from the regular council meeting held on January the 10th, 2018 have been printed, posted, and circulated. Are there any corrections to the minutes? If there are no objections, then the minutes will stand approved as posted. Thank you. I'm sorry I missed that. First item on our agenda this evening is a capital expenditure from the police department. It's a police software solutions upgrade. Mike or Adam, would you like to tell us about this new system, please?
Sure, I will. A couple reasons we're asking for this software upgrade. In 2009, the police department started with a records management system called InSync. And at the time, it was a major upgrade. We didn't have a records management system before then. And over the course of time, other companies have come on the market. Over the course of time, the InSync system, which is common with every records management system, they charge a yearly fee for maintenance on the system and to upgrade the system. This system, since we got it in 2009, has increased an average of over 9% each year. They don't give us any indication when they're going to increase. Some years it's zero. There's been years it's been over 20% increase for this. So currently, this maintenance fee per year for InSync is at $14,535, which is a substantial amount of money. So, looking at this, I don't know what the fee is going to be this year. They charge this fee probably by design right at the beginning of July, probably because there's no way you could ever transfer in the middle of to get ready for your budget to another system if you wanted to. It would take quite a while. So the reason I bring this to you now is mostly because of this fee. So I don't want to pay this $14,535. Another system called Zerker is out there that I'm interested in. Parkersburg Police Department and our 911 center has already gone to this system as well from InSync. There's many more features to this. It's a major upgrade for us. I think it'll really revolutionize the way we do business. With Zerker, one of the benefits of this new records management is they will give you a 5-year plan on exactly how much they're going to charge, and with it from year to year. So they're going to charge. They've already set a 5%, up to 5%. So it's going to start significantly lower. I've done a cost analysis. I sent everybody an email with a letter and this cost analysis that I've done, and just with this maintenance fee alone. And that is if InSync stayed at $14,500. In 10 years, we would save almost $45,000 just on this maintenance fee. So I think this maintenance fee is just a runaway train. I don't know where it stops. That's why I come to you, midstream here in the fiscal year to hopefully get this new records management. The features are fantastic. I think it's going to upgrade officer safety, what information officers are getting in the field. InSync also charges us whenever we put records management on another computer or we get a new user. I mean, it's $500, and it's just ridiculous, I think. So when other things are out there, I think we can save some money. It will take some time, and it does take some money up front to do so. But I think it'd be a great move for the police department. So if you guys have any questions about this software, I'd be happy to attempt to answer them.
Jim?
Chief, with respect to, we talked about this in Budget and Finance when we recommended it brought to council for consideration. Just so everybody understands, I think a couple of important points. First of all, included in this transition is the data transfer from the InSync system to the new system?
Yes, so all that data from the past 10 years that we've put into InSync, part of this is Zerker has before for other police agencies as well as they can for us. That is included in this cost to transfer all that.
Then can you describe, you mentioned both 911 and the city of Parkersburg are on the new system, correct?
That's correct.
So what would be the situation if we did not upgrade with regard to our ability to kind of integrate with these other law enforcement and 911 centers?
Well, to get an understanding, it all starts with computer-aided dispatch at 911. So their CAD is what they call it. So when information comes in and the dispatcher is utilizing this CAD, with Zerker, this was not happening with InSync. With Zerker, that information that the dispatcher types into the CAD or is automatically placed in the CAD via the phone system, the officer will be able to see that on a computer or a cell phone, or that it is instantaneous. And that is one of the best features, I think, in my mind, for officer safety. It can be as specific as a suspect description or stolen license plate, whatever it is, and situations get pretty tense pretty fast. That is a fantastic feature of this. So right now, if we don't go to this, the CAD at 911 through Zerker translates all this information to their records management. Right now, all of that information is translated into the InSync language, what we have. So since they have changed, which was in November, December area, this change in language, I guess, for lack of better words, has caused us, we've had to change the way we do business a little bit. The way we keep our records and what those things say, because it doesn't even look anywhere the same. It was kind of like learning a new language all over again. So I'm not saying we couldn't stay the same what we do. We would probably have to find some alternative things on how we do business. I mean, we've kind of temporarily done that now.
So with Zerker, with 911, that enables our officers to be real time with 911, correct?
Yeah. Part of Zerker is they're on one server. All these, so Parkersburg Police and 911 are on the same server. So when it's instantaneous, right now these servers are integrated. We take care of our own server for InSync. So Adam can tell you if the server goes down, we've got to take that out of pocket. One of the bonuses from Zerker is they actually take care of the server. It's their server. Now we got to get the information to the server, but that in itself is an upgrade. So is
Thank
it
you.
possible we stay? Yes, it's possible. We would still conduct business and be professional police agency and all that stuff. But I think, aside from all those technical things, I think the money aspect, and that was with just the number I have right now. They did do our planning and upgrade in February, I do believe, and I'm sure you'll see an increase in the fee. So if it's anything like it was last time, it'll be about 20%. So we're going to be up in the $17,000 range real quick, and I don't know where that ends. That's a lot of money. So it's kind of twofold. It's technology driven, and I think it'll be a cost saving feature over the course of time.
One of the things I'd like to talk about for a moment is, Chief shared with me the other night, on my iPhone, the live thing that you're referring to, Jim, when we had the bad storm and it was so icy out and the roads were so terrible, I believe there were 13 active accidents at the same time in different parts of the county. I had all 13 of them on my iPhone. I mean, that's how informative that thing is.
And that's just a feature of this system, and that's not even what we have now. I'm not bashing InSync or whatever it is, and it was good for us at the time. They don't have anything close to that.
And Mike, if I understand it, the total cost on this would be $69,500?
It's at $69,477 is the exact number.
All right. Any other questions? All right. Then I'll entertain a motion for the capital expenditure for the police department for the police software solutions upgrade in the amount of $69,478, Mike?
77.
$477.
So moved. Second.
It's been moved and seconded that we approve the capital expenditure for the police software solutions upgrade. Is there any further discussion? Hearing none, then I'll call for the question. All those in favor, please signify by raising your right hand. All those opposed, motion carries unanimously. The second item on our agenda this evening is the start of our budget presentations. This evening, we're going to hear from the building inspector, the planning and zoning, code enforcement, police department, the police judge, the fire department, and data processing. So we will start with the building inspector.
Russ? Luther?
Dwayne, you're going to have to talk into the microphone.
Okay,
I apologize.
that's okay. Is that better?
Oh, yes.
Okay. All right, we'll start with 436, which is the building inspector budget. It's down a little bit from what it was last year, maybe a couple $1,000s. In my opinion, that's basically about as low as I can go on the cuts. Are there any questions per line item that you, in looking at it, you'd like to ask? Or?
I got a question. Correct me if I'm wrong, but last year was this we kept you on. You're going to retire. Is that? Am I missing something?
No. Well, he is going to retire, but he will be retained because of all of his certifications, and he will become a part-time employee with no benefits.
Okay, because last year we approved more money in the budget because you were staying on, plus we were hiring somebody else. I thought that was just for a year, but we're going to keep Dwayne on as a...
There is no one that has the certifications that he has, which we are required to have. And so we're going to go to a 2-day or 3-day schedule and schedule in the appointments that we need for commercial inspections and things that only Dwayne can do. We do have another employee that is being trained. He is going through the certification process, but he is no way near up to Dwayne's level, which we're required to have.
And that was in this year's budget here. We just completed, right? I mean, his position, his salary?
Yes.
Okay.
Yes.
Correct. Yeah. Do you know how many total employees are in the department now?
have, three.
Three.
Yeah, if you- the permit technician, which is Sean, she does, she works in a lot of other areas too. I know, you know, she takes care of all FOIAs, takes care of the collections, she does the CDBG, money, so.
I'm sorry, go ahead.
I'm sorry. The biggest, I'm just going to touch on the biggest line item there. Professional services, what does that pertain to typically, Dwayne?
That is, plan reviews,
Okay.
in most cases.
Okay.
That's plan reviews. They're paid, right now, we're running probably within, when we receive the plan review and finalize within overnight or 3 days of receiving the plan review fee from the owner.
There's a revenue collected that offsets that account.
Yes.
So
Okay.
that's budgeted
Yes.
on the revenue side, and then this is the expense that we pay out. But it's a wash.
Okay, thank you, Amy.
Yeah.
Dwayne, I was just going to ask you, is Sean's payroll wholly within your department, even though she wears these other hats?
Correct. Yeah.
Are you,
Actually, the material and supplies, a lot of that is out of my department too, for all the CDBG, copiers, time, FOIAs, that's in this.
Okay, I understand.
Okay?
Right.
Dwayne, before we move on from building inspector?
I'm sorry?
Before we move on, I know that you have data to show the amount of building inspections, building permit fees that were generated last year. I have those numbers, but I'll let you share them if you like.
Sure, I can. Our total construction costs that we did inspections on and collected fees for the city, commercial and residential, was $12,987,698. Our fees collected was $86,624.
That is a incredible increase from the previous year. The previous year, I believe we had $6,600,000 in building permit.
It's possible.
Yes, $6,600,000. It's almost double this past year that we did the year before. So your department, through the fees, offset this amount right here, $86,000 is what was generated for that. So it's incredible. You're very busy.
Thank you.
So
Yes,
Parkersburg, of course, is higher, but I think a lot of their total construction costs this past year was the hospital. You know, they completely redid the hospital and new cardiac care. I think theirs was around 20, so ours was basically 13. I think their total fees for the year was maybe 112 or 116, and ours was 86. That's pretty good. They have a lot more people.
Yes. Mr. Bibby?
Oh, I was just going to mention something that a few people would mention to me relative to the $13 million in the building fees. There's a little bit of a misconception in the community. I know, Mayor, through the media, you had supplied some information to the media where you addressed that $13 million fee, and on more than one occasion, I was asked about that. The misconception was that the city was receiving $13 million in building fees, and I explained that wasn't the case, but I don't know if anybody else experienced that or not, but yeah.
Our portion of that's the 86,000.
Pardon me?
Our portion of that is 86,000.
Right,
Yes.
sure, yeah. but just thought I would share that because there was a little bit of misconception that that was what
Yeah.
had happened.
I also got a call from the county.
Did you? Okay.
Oh, yeah. Oh, yeah. So, Mr. Elam?
Most of my questions are back to you, Dwayne, because I've heard good things about you, but, you know, we're training this guy who doesn't have your qualifications. But what's the plan in the future? Is he gonna be fully trained one day to do your job, or are we just gonna continue to?
Well, I'll answer that. You can answer that. I know you're not gonna work forever.
Right.
No, I hope not.
He's been trying to escape
We got
for
a
a
lot of
while.
years in here. I don't wanna go too many more. Right now, he had taken already, we didn't even have to do a provisional for him through the fire marshal's office. Because, he had taken and passed his test on, what it takes to be code enforcement, okay? So he is and will be code enforcement, and he will also be planning and zoning when I feel he's ready to take that over.
Okay, thank you.
I don't know if you remember, Mike, but when we talked about this previously, the certifications that Dwayne holds, he's been here so long that originally it took 3 certifications, and it now takes 30 how many just to get to your level?
Well, it'd be total of all probably 36, I think. That's the list. I mean, it's on the fire marshal's office
Yeah.
website.
So that's the certifications that he holds now, and that's the reason why. You just can't buy those years of service.
The guy replaced you, better looking. Is he better looking than you?
Huh?
Is he better looking than you?
Yeah. Way better.
Thank you. You want to go ahead?
Yep. We can go to planning and zoning is pretty much what it is. About the only time, you don't have to use too much out of that. I think we did have to use a little bit last year on a couple of legal notices, didn't we, Russ?
You need to pull the mic down. They want to hear your pretty voice.
Okay. I got so dry right now. I am not Mark. I can tell you that. We had to use a couple legal ads. Russ put in on the zoning. Other than that, I don't think planning and zoning's changed denominations in that budget for 8 or 10 years. So. So we can move on to 725, code enforcement. I think I reduced it down basically, about $1,500 overall. That was about the best I could do on that. I think one of Roger's questions last year was about contract services, and so this year I didn't. I had 4 houses taken down this year without any money or liens. They were taken down by property owners. So.
Questions?
Any questions?
All right, Dwayne, thank you very much.
Okay.
Chief Pfeiffer, you're next.
Okay, we start with the police or police judge?
It's whichever you like. Police
matter.
judge is actually first in the sequence,
Okay.
but whatever you like.
The police judge, there is no changes in any of the line items. Unless there's any questions about the police judge, we'll just get that out of the way. Okay. For the police department, we'll start line items 1 through 10, salary and wages. In that, I'm going to ask for $2 increase for every police officer. I sent a letter to council back in October outlining why I think this is much needed. With that letter, there was a pay study done on the surrounding agencies as well. The Vienna Police Department, our starting officer is at $16.34, which is about $2.50 lower than the next agency here in Wood County. So I think some other agencies in the county have provided some much needed attention. There's issues with police officers nationally, even wanting to be police officers, targeted violence. People just aren't coming forward to be police officers like we once had. We've seen it in our numbers here when we give tests. The other agencies around us and in Ohio are seeing the same stuff. So I think it's something that we should do for our police officers. We need to not only court new police officers, but we need to retain the police officers that we have. So part of that letter, a good police officer with all of the training, education, and experience equals a more competent officer. And that's what we're looking for. When you have a competent officer doing a very good job, it increases the value of your community. It really does. So, and you all up there on council and in the audience can probably think of somebody that you respected very much who spent a career doing this job, and you thought, well, that guy or gal, whatever it is really good for the community. So, and I have those people come to my mind, even when I was a kid. So that's something that I think that we need to do. So is there any questions about that? Yes, sir.
I saw where Parkersburg was giving a $10,000 sign-on bonus for officers coming to Parkersburg.
Wood County is as well.
They also have a $3,500 fee for anyone who has prior certification. I don't think ours is that high. Have you ever thought about raising that?
I have. I typically that amount or that strategy, maybe I should say, is really new. Typically, we don't see a lot of movement inside of Wood County. We definitely don't draw in a lot of police officers from outside of the area. They come here and say, hey, I'm from Pittsburgh. I'd like to be a police officer here in Wood County. That doesn't happen very much. So with that aside, then it's moving from agency to agency within. We really don't see that much. Typically, Vienna was the end zone for a lot of officers in our area. I mean, they worked at Wood County Sheriff's Office, and they worked at Parkersburg Police Department, and they ended up at Vienna PD. I'm not sure that strategy is going to work yet. Just on a one-time bonus. Sure, it's something to consider, and maybe if it works for these other departments, then maybe we should visit it at that time. I think if we compensate them from the beginning, and even that $2 increase on salaries and wages, we're still in last place, but we were just sitting there talking about the total compensation plan for the officers. We still have great training, we have great equipment, we have a good police department, and with that total compensation, it gets us in the ballpark. I mean, it's not all doom and gloom. We're a good place to work. So, just about we do offer a $2,500 hiring incentive if you're already a certified officer, which is significantly lower than the other agencies here in Wood County. But To me, I'm not sure that's gonna be a deciding factor. Just a one-time bonus that an officer's gonna say, well, I'm just gonna go for this big bonus and maybe look at a little bit bigger picture. If that is, and that starts working somewhere else, and we see we've lost out on officers because of that, I think at that time we should visit it.
Chief, one of the things that jumps out at me here is this line item 16, and I mean, not that we don't like to see reductions. That's no small amount. Will that work for your maintenance equipment?
So in that was the decrease of what I was talking about before for the records management.
Okay.
So it's that 14,535 immediately
That
come
gets
off
it.
of that.
Okay.
Okay, so radio issues, we pay computer security out of that line item, in-car camera maintenance, electronic issues. I know the dispatch console was an issue. We've had it worked on several times. That may be something we visit there, but for that, I think we can take off 14,535 because I sure don't plan on paying that.
Okay, good. Thank you.
So moving on, unless there's any other questions.
Yeah,
Yes, sir.
Chief, back up to the $2 just briefly. Obviously, an additional $2 on overtime is going to be $3, I assume, on overtime.
Yes, on overtime.
What would a typical overtime week, month, or however you want to categorize it?
We really I think we do a great job in overtime. Most of our overtime costs come officers attending court. And that varies from week to week. But I don't know, Amy, if she could tell you about the police overtime. We do, it even comes down to training.
Not specifically,
yeah, but
generally,
just
a small amount, or, you know, is it something that happens on a regular basis, or?
How much we budget?
Yeah, for overtime.
We budget for overtime 15%.
15%, okay.
So there's some things in-house you do, to keep that cost low. Some of it is, training costs. We are training more at the Vienna Police Department than we've ever done. We are getting certified instructors on our department so we can come back here and train. So every piece of equipment, down from your firearm to your taser to your OC spray to whatever it is, you have to have annual training on that. If we send everybody out for training as a cost-saving measure, let's do it in-house. That cuts down on overtime. So anytime that it's something everybody's got to do, we pick either it's going to be a certain day where we have some overlap on that day, or it gets scrutinized pretty heavily on the overtime. So
thank you.
Even down to the shifts per day and when we overlap and why we overlap at that time, that comes into play.
And that 15% doesn't necessarily mean it's going to be encumbered. That's
We
just what.
just set that money aside.
Right, yeah.
And it's in that total salary number.
Yes, okay.
Okay, so we'll move down to line item 11. This is the phone line item. Asking for an increase here. I had $10,000. I really probably can trim that because this past year we did save some money. The police department provided the officers cell phones. So through a broken cell phone or two, before it was time to renew, it was just going to blow our budget out of the water. Midstream, I changed that. Probably got some frowny faces on the police department, but we issued the officers a stipend so they can use their own phone. It saved us some money over time. The reason that the increase is right here, to go hand in hand with that records management system, my vision is in the patrol cars to put professional internet service in those cars. What that's going to take is, in this line item, will be whatever carrier, if we would get granted this money, we would pick to provide that internet service for in the cars. And then I'll touch kind of on this at the capital expenditures at the very end, to kind of bring that home. So that's why the increase here.
Is
So
that like
we'll
a hotspot kind of?
Well, it's kind of a hotspot on steroids, if you will. This is a mobile modem that will upload and download speeds are greatly enhanced through this mobile modem. There won't be dropped areas, whatever we could send. 911 could send you in a police car instantaneously photographs, maps, driver's license pictures, whatever it is, like large files, very quickly. We did at one time, we had the hot spots. They, you know, the little circle when your computer's thinking. It takes a lot to run a records management system with a little hotspot. It got so tedious, or we couldn't wait for it. We ended up scrapping it. It just didn't work out for us because it was just too much for the system to handle.
Been there, that's what I asked. Yeah.
So that's, in actuality, that increase is probably going to be less than that. We haven't sent anything out for bids or anything like that. That would be a complete maximum amount. So that's why that is the way it is. So unless somebody's got anything else on line item 11, I'll just move on. So 12, 13, 14, 15, no increases there. 16 is what I touched on with Mr. Bibby, decrease of $14,535. Which that cost, when I talked about the records management before, next year we would pick that up with Zerker. It would have to go in that line item for that maintenance. Significantly lower, but it won't be $14,535, I already know that, but that's the big drop in that one. 17, same. 18, no changes. 19, no changes. 20, legal publications, I asked for a $500 increase during our last go-round for officers being hired. When we tested, I did put up a radio ad. We got lucky, folks. We had more people than the surrounding agencies did test, which was very lucky. Maybe the radio ad helped. I thought it did. The newspaper, we wanted to try to go there, but we just couldn't get that worked out. So it was something quick that I thought we advertised a little bit that may have paid a little dividend. So 21, training and education, asking for a $3,000 increase there. We're going to have some incurring academy costs come up in this, and some of those costs for instructor classes have gone up. So that's why I'm asking the increase in that line item. If there's any questions about that, I'd try to answer that. 22, 23, well, we'll just go through 33. No changes in those. Line item 41, materials and supplies, asking for $1,000 increase from that, 14 to 15,000. That's just stuff as like trash bags and paper towels and whatnot. Just the cost of those going up. We went a little over a couple years ago, so we try to keep that as low as we can, but costs go up on stuff. 43 remains the same. Line item 44. Decrease this line item to 0. This was our prisoner transport item. This is a direct result of the state DOC taking over the holding center, the regional jail. So we were having to pay $49 per inmate to get them out to the regional. We don't have to pay that anymore because theoretically the regional's here at the Justice Center now. So that line item is completely eliminated. So that was $7,800 last year, or this current fiscal year. Line item 45 in uniforms, asking an increase of $1,000. That's just inflation going up. The year for a new police officer is quite a bit of cost now compared to what it used to be. So a little help on that one. 57, 58, 0, 59, the capital outlay. So asking for 2 cruisers in this line item. We have a space for 20 officers as a police department. In my mind, I think if we can get 10 years out of a police cruiser, we're way ahead of everybody else. And the guys really do a good job with their car. And we've done well this past year. So if I can come to council and pretty much get 2 cars a year on the average, that's what I'm hoping for. So asking for 2 cars fully outfitted And I'm also asking for 13 cradle points, which is the mobile modems that I talked to Mr. Leach about and the rest of you, and we were trying to explain what that is. So those cradle points are roughly $900 a piece. And I've been working with Adam on exactly how long these are going to last, what can we expect. The life expectancy of these cradle points, they're saying 8, 9 years. I'm thinking if we can get 10, that would be the whole life of a cruiser. The cradle points in there. So that line item I spoke of earlier with the phones, that would go in with these cradle points. So the service gets to the cradle point, you get professional internet quality from your car, and the bonus of this is to keep these police officers in the field. So right now, you go from a call, report, you come back to the police station, they get it typed up, they go back out, and it's like a little beehive. The more I can keep them out there, the better service you get, and the more policemen you see. So the closer you are to the next call. So indirectly, that helps that as well. So I think that really brings this Zerker records management system home. I mean, you will see all this stuff from inside your car and be able to do things that you were never able to do, but people that watch police shows thought you could do to begin with. So it really, really, really revolutionizes the way we can do business. So hence that cost. So I can try to explain it any further. Any of those points, that's the entire police department budget. I'd be happy to elaborate on any of those now, or if you want to meet with me in between now and into budget time, we can go over even with a finer tooth comb.
Chief, actually, I did want to follow up on one thing.
Yeah.
And this goes back to what you were talking about with respect to the total compensation package.
Yes.
And the issue of some of the sign-on bonuses that other departments are trying to utilize to recruit officers. And you mentioned you weren't sure that was a great strategy for Vienna. And I just want to make sure I understand this, because I think this is going to be a recurring theme as we go through this budget process. Can you describe, for example, what the city of Vienna over time has invested, for example, in the police department, in the financial responsibility? Let's take example our pension plan for the city of Vienna compared to Surround. I mean, so when we talk about a total compensation plan, isn't it true that overall, regardless of some of this bait that's kind of put out there by other departments versus the sound management of our police department, isn't that what really kind of takes that to the end zone analogy
when Mr.
that you
Schwindeman
used?
talked about that pie,
right.
That was a very good correlation or example, because it is the total package. Yes, I'm not asking to be in first place. I'm asking to get in the ballpark is what I'm asking for.
In combination with the other attributes that you have to offer your officers.
You have good opportunities here.
Okay.
I was lucky because I got to spend years on the narcotics task force. I worked with agencies all over West Virginia, Ohio, and beyond. Vienna Police Department has a very professional police agency. So.
Okay, thank you. I just wanted to make sure everybody understands it's not just,
No, it's not just about this dollar number, but what you get into, a young police officer, and I was at one time, 20 odd years ago, and they don't see that as much. There is the dollar per hour, and they pin the tail on whatever department they think is going to be best at the time. But when they get down and actually see what's out there and are smart about it, and that's something that we can use to our advantage here when we're courting people that want to apply for the police department. So, and that's why I said it's not all doom and gloom. I think if you get in the ballpark, I think we'll be in good shape. And if it needs addressed again, we'll address it again. But at that time, so.
Thank you.
Mike, I was given some statistics recently where they've ranked the cities in the state of West Virginia again. And the city of Vienna is ranked the third best city in the state of West Virginia, behind Hurricane and Bridgeport for quality of life. And I know from your officers and all of the good job that they do, and the other departments here that maintain all of the services for the city, that all contributes to that. But to be ranked third out of 230 cities in the entire state, I think that says a lot for the job that you all do and the other employees in this city. So kudos to you because
Thank
it's,
you. We like to think we contribute to that. So, everybody does. It's not just the police department, but that is a large part. If people don't feel safe, they're not gonna come here to do business and, or they're not gonna live here, so.
well, there are many factors in that, but one of them obviously is crime statistics, and so we are a safe community, and that's a great plus for us. So
That's the name of the game.
it is.
So, I know, that, and I'm fully aware about home rule, and it's up in the air at this point. I understand that. Probably because of that factor, there won't be, extra monies floating around, and I understand that too. If there's other civilian employees in the city that are up for any kind of compensation raise, I would ask for the police department civilian employees to be included as well. But I want to be specific about the police officers this year.
Okay.
Okay?
Any other questions for Chief Pfeiffer?
How many, now that you mentioned that, how many civilian employees are there within the department?
Four.
Yes.
We have 4. We have 6 part-time, and they man the front desk.
4 full and 6
nights.
part.
Yes, so it'd be nights, weekends.
The crossing guard money is also.
I'm sorry,
yes.
crossing guards as well. So yes, we could add the crossing guards in, which are 5. Okay, thank you.
Thank you.
Thanks.
Good evening. What I'm going to do in my budget is just going to talk about the line items that I've either reduced or asked for an increase in. I'm going to start with line 14, which is our travel part. That line is used for when we send people to the any schools we have that are out of town, plus the State Firemen's Convention. I've asked for a $500 increase on that line due to the increased price of hotels and the staying. This year's State Firemen's Convention will be in Charlestown, so that's going to be a little more expensive than what we've been used to in the past. Any questions on that one? Okay. Line item 15, maintenance of the building and grounds. I've asked for a $25,000 increase on that one due to the fact that the front ramp at the main fire station here on 28th Street, it's the original concrete that's down there. Most of it is. There's been a couple slabs that have been replaced and they're even cracking, but there's a crack and crumbling in each section of that of the ramp, the concrete on it. That's not including the part in front of the police annex or the part in front of the fire station annex, just the main fire station where we respond out of. And that ramp's got trucks going across it daily from anywhere from 22 tons to 35 tons. And I don't want to get into a situation where we had like in the parking lot across the street here where it just finally caved in. I'd like to hit this ahead of time if we could to prevent that problem. Any questions on that one? Okay, moving right along to line 19, that's the rents. That'll be the payments for the apparatus we have. We have 2 of them that'll be having payments on. That'll be a $110,000 reimbursement back to the city from out of the county fire fee that is collected. I believe last year, Amy, was that 2,000? Well, this year, so I think we.
110 this year.
Okay, 100, so it'll stay the same. It'll just be reimbursed. The city will make the payments, and the county fire fee will reimburse the city the $110,000 out of that. Any questions on that line? Moving on to line 22, dues and subscriptions. I'm asking for a $400 increase on that. That's due to the fact that the app we use on our phones to help alert all of our members for that we have calls. It's the Active 911 app that's operated through the 911 center, but we pay for it here on our phones. There's been an increase on that for each individual's phone. And the PO box that we rent is going to start coming out, is going to be put into that category. So I'm asking for a $400 increase on that line. Moving on to line 41 on uniforms. I'm going to reduce that line to reduce it by $2,800 due to the fact that I'm doing a rotation of our what we call our turnout gear, the firefighting suits that we wear. I'm pretty well caught up on that, but I won't need as many of those. They're good for 10 years, and we have to keep rotating them, get them in, but I'm pretty well caught up on that, and I won't need as many sets of turnout gear as what I've needed in the past. Moving on to line 57, the capital outlay of the buildings. That one I'm asking for a $20,500 raise on that one. That's due to a couple items in there. In our fire station, we have a what we call the hose tower. That's where we hang our fire hose after we've had a fire and it gets wet. And it's got a heating unit in there to dry the hose out to speed up, especially this time of year. It would never dry if we didn't have that. That unit is roughly 40 years old, and we've had some problems with it, and the technician's saying there is no more parts available for it. They're piecing that thing together every time we have a problem with it. So it is $10,500 for that. The next item is in that line is to put a fire hydrant out behind the fire station. When the police department had the annex put on beside ours, we had a fire hydrant right out by the corner of the fire station. Due to the laying of where the building's set and everything, the lines had to be taken out where that was sitting. And at the time, in our annex building on the other side of the fire station, they put us a wall hydrant in, basically. But it's only fed with a 2-inch line, and it's regulated through your whatever pressure is in your houses. And it just does not have enough volume or pressure to do our hose testing, our ladder testing, because we have the tire trucks, we have to test the waterways in the ladders. And when we refill the trucks, it's just not functioning the way we'd hoped it would. We've tried it for roughly 4 years now, and it's just not working. And the city street department would put a fire hydrant in that had to bore through, feed it off of 29th Street here, bore underneath the 29th Street, come across that alley or the new lot over there, the empty lot, and then bore under the alley and then set it over beside our fire station. They're saying that'll cost roughly $10,000 for that. Any questions so far?
Steve, did you say that heater was 4 years old or 40?
40. It's roughly the same age as the building.
So it runs off candles?
Yeah, you gotta get up there and light them every once in a while, so. Line 59, the capital outlay for equipment. I'm reducing that line by $3,000 due to the fact that this will be the last year to upgrade all the trucks to the new 45-minute SCBAs. So this year we'll finish that out. And the reason for the reduction is I won't need as much new firefighting hose. I'm pretty well caught up on that now. So that's all my requests and changes on my budget. Does anybody have any questions at all?
Just mine's more of a curiosity. So since they've implemented the countywide fire fee, what kind of impact has that had for your department's budget or revenue generated from that fee compared to what used to be the Vienna fire fee?
Okay. The Vienna fire fee used to be roughly $107,000. I think it was roughly $107,000. We're getting, and it varies because of the collection process and everything. I believe it's roughly $128,000, I think is what's being collected per year for our department. That leaves us, we used to get $17,000 from the county without the fire fee. Each volunteer department got that. We use that money for fire prevention brochure and everything for the kids, roughly. We do, I think it's roughly 1,000 packets for the kids during the fire prevention week, plus all the other tours and everything we have in. I did an analysis a while back. What we spent was roughly $11 per child to give those packets out and everything. And to me, $11 per child to save a life is well worth it. So we use that mainly $17,000 again just for that, and the rest of it we use for buying some miscellaneous equipment, things like that. So it's increased our revenue a little bit, but most of it goes to, like I said, the truck payments or wherever the city decides they need to use it to get reimbursed.
I was just curious. Thanks, Chief.
We've only had one full year of collections from that because the way the county implemented it, the first year was a year and a half. It took a year and a half to phase it in, and then we received one full year.
So we're still in the learning stages of how this is going to work out for us.
Okay, thank you.
Any other questions on anything? I'd be more than willing to talk to anybody about this, contact me in my office or, email me, whatever. I'll be glad to go over any of this.
Thank you, Chief. Adam?
Hello, everybody. My name is Adam Clegg. I'm the IT director for the city of Vienna. So imagine you're walking into an office at the city and only seeing a typewriter, a desk calendar, and an abacus for a calculator. Sounds odd, right? One glance of this combination would be a recipe for disaster. Why? Because we've all evolved. Our employees and our citizens have high expectations, and it's up to the IT department to meet those expectations through technology and convenience. We know all too well what it takes to keep the wheels turning. It's the underlying technology, which in turn winds up being a crucial part of each department's everyday needs. And just tonight, you've heard from the police department talking about software, servers, mobile hotspots. Fire department, God bless you, Chief, has apps that notify everybody. Dwayne spoke about data, pulling building permits. All of that is taken care of on the back end by us, the IT department. So with that said, I'm going to start off with personnel services as items 1 through 10, and I'm just going to touch on the highlights tonight. While I understand this may be an unpopular request, I am respectfully asking for a pay raise for myself, my tech, as well as requesting additional help in our department. I have been employed by the city of Vienna for 17 years. And when I say that out loud, it's kind of scary. But during that time, I have personally built, installed, configured, or overseen the infrastructure that we currently work under. I believe that experience gives me a unique insight as well as a better understanding of the big picture, and it allows me to better anticipate the city's growing technological needs. The days of hiring somebody off the street or fresh out of college for a specially designed position such as IT are over. IT requires a very particular set of skills, and those skills need to be coupled with several years of experience to be effective. The IT department supports the demands of each and every department around the city. As each department workload increases, inevitably, so does ours. IT works 24/7, 365. It never takes a day off, and neither do we. I've worked on evenings, weekends, sick days, holidays, and even on my honeymoon. Sorry, honey. Therefore, I'm requesting that my salary, the salary of my tech, and we add additional staffing in our department to offset the continued increase in responsibilities and demands we encounter each and every day. Moving forward, items 11 through 32. First one is item 11, line item 11, and that's our telephone. I am tentatively asking for $540 to cover the telephone expense for an additional employee. Line item 22 is our subscriptions. Over the past few years, we have been moving items from one department's budget to another to better consolidate and track expenses. The increase in line item 22, I'm asking for $6,000. That covers all subscriptions for every department throughout the city. Now, those people in the audience, those subscriptions include things like our email, our web hosting, firmware updates, intrusion prevention, gateway antivirus, advanced threat security, remote admin, Microsoft Office, product suites, network monitoring solutions, system management, appliance. I could go on and on. There's a breakdown there for you and council to kind of give you an idea of what and where the money goes. Line item 41 through 35. Line item 41, I have not requested an increase in this line item for a few years. However, with future projects planned this coming year, I'm asking for $3,000 to cover that additional expense. We have things like Zerker, our virtualization project, equipment consolidation, and wiring management are just a few. Line item 45 is our uniforms. That covers work shirts and pants. I am, again, tentatively asking for $250 to cover for that additional employee. Line 59 is capital outlay. That's going to be my big one. And each year I stand before you. We have a predetermined rotation schedule currently in effect that varies year to year. I've listed a breakdown for council from desktop computers to our laptops, our air fibers, our servers, our routers, switches, network attached storage, server racks, iPads, etc. It's broken out per department. You can kind of see the cost and where that money goes. For example, a laptop, desktop, try to keep for 4 years in a what I would consider a mission critical place. And at that point, after the 4 years, we don't just get rid of it. I then move it to a less mission-critical area, senior center, some of the stuff in our parks area, community building, et cetera. So that allows us to kind of put machines out that still have a useful life without purchasing new ones. That has worked out extremely well. In that instance, we can keep things around for 8 years, depending when they finally become end of life. Servers and switches, routers, 6 years roughly, depending. Moving on. I should actually cover that cost for those items is $44,800. Moving forward, our 5-year plan we've been working toward each year. Last year, you guys were kind enough to grant me the money to start our virtualization project. With that, this is the second phase. I'm asking for data storage. And without getting into a bunch of specifics, I'll be happy to do that if you guys want to do that after a meeting sometime. It essentially is, I'm asking for $40,000 because we're quickly running out of space. This data storage unit is accessible 24/7, 365, highly secure, redundant, and it reduced energy required to power, cool, and maintain. It impacts a lot of the different departments and the software packages that we run. Again, that's listed there in front of you. So you can kind of see what that touches. Lastly is our transportation. I've talked about this before, and our Jeep is more than just a Jeep. It's something that we use, obviously, to get from A to B, but it's more than that. Actually, I've actually got a picture to show you guys. This is just some of the tools we keep in the back of this thing. You can kind of see our ladder, our toolboxes, our testers, wiring, drills, etc., our cable boxes in there, labels, everything we need to run wire, pull a server, replace a machine, whatever the case may be. Some safety equipment's in there as well. And it's one of those things where if we're working across the city building, or we're down at the senior center, or we're at the parks department, or we have a meeting to attend, or one of the our tanks, wireless goes down and we have to take care of that, I can't let snow or rain be an issue. So this thing has worked perfectly. It's 4-wheel drive. It's over 14 years old, approaching 100,000 miles. I would venture to say it's probably one of the oldest vehicles that we have that's not like a dump truck or something. To be real for a second, it's time that we get a nice vehicle. The taillights blow out when it rains. The driver's seat's broke. Only has one door lock now. No AC. And that's probably not a problem except when it's midsummer and it's raining and your windows fog up. It's not a fun thing. So I'm asking for a vehicle as well because I'm concerned that this thing's not going to last much longer. We've put money in it, radiators, front end work, and at some point you just have to say, call it for what it is. So that wraps up pretty much the rest of my presentation. I would extend an offer to each and every one of you to come spend an hour with us. I could walk you around. You'd be surprised the amount of equipment that we have at the fire department or we have at the parks garage, of all things, that extends wireless, the equipment that we use for our emergency phone in McDonough. All of this stuff that we use, from something as simple as a credit card machine when we pay a water bill to our in-car cameras in our police department, what it takes to manage that, secure that, back that up, off-site that, and the infrastructure that we have in place to manage all of that. That all comes down to me. It rides on me. And if there's an issue, I'm the one that gets a call, whether it's 7:30 in the evening or 1:30 in the morning. I love my job, or I wouldn't be here. But with that said, it's time for a change. So I'm asking in front of you to kind of lay it out, let you know what I'm up against, and where we'd like to move in the future. So at this time, I'd be happy to answer any questions. Yes, sir.
With all that equipment in there, wouldn't it be better for a van or something like that?
I've thought about that. I actually priced a van. There's, I think, a $4,000 difference on state bid. So one of the things with the van, it's not 4-wheel drive, 2-wheel drive. And one of the reasons I like this a lot is because we can stack our stuff in there and it doesn't shift. Thought about a pickup truck, but again, when I want to grab a toolkit or I want to grab whatever, it's all right there for me. We have things in the back seat that you can't see, depending on how we've got it organized. This is what I've had, this is what I'm used to, and it works extremely well for us. So I'm not looking to reinvent the wheel there. So, I mean, that's, you know, it's an old Jeep that we had, and we made it work. So, a lot of the times, like I mentioned, we do work. We had a call not too long ago where came in on a early morning, and the wireless was down at one of our tanks, and up on Jackson Hill there, we had to drive up, and that's not the best road to get up. So if you guys have been out that road, you would understand. I mean, that's just one of the places, OVU tank we'd visit, different things. So having something that can get us out, whether it's rain or snow, makes a big difference.
Adam, under
Yes, sir.
43959 capital outlay.
Sure.
So you're talking about replacing 10 servers, physical servers, with, are you talking about one redundant virtual server, or?
No. So,
go ahead, explain that, how that's
sure.
going to work.
So last year, we actually have now we have more than 10, if you count them up across all the different departments. So last year I asked for money to consolidate all of those. This is the data side of it. Server side hands out, does a lot of the background services for the network, whether it's wireless or what have you. They are all taken care of. That is a project that we're actually in the middle of right now. I would like to have completed, you know, by July. So what I'm asking for today is the data side. It's where all of our stuff is stored. All of those servers, when we bought them years back, they're different ages, have, that's how I'm going to put this. The hard drives in them are relatively small, but because of the size, we have multiple servers. So as a whole, there's a lot of space. When we start to consolidate, it's priced more effectively to consolidate to 2 servers that are virtualized. You have a primary and a backup. For obvious reasons, one fails. You don't know that one's failed, it rolls over. For those 2 servers, you then dump all your data to this. You can expand it. You guys actually have something similar at your business that you run. It's a SAN, a server attached network storage. So given the amount of data that we have, in-car camera, all of our documents, our files, payroll, I mean, I could go on and on. There's a lot of data that the city has, and then we back up. So we have to have somewhere to put that. Right now, I've got it strung across 10 different devices. This would consolidate it into one place, safe, secure, and redundant. So as our needs increase, I could slap in another drive. I don't have to go ahead and buy a new one next year, the year after.
Okay.
Does that answer your question?
Yeah, it does.
Okay.
It does, thanks.
I know I've thrown a lot at you. I apologize, but.
Questions? Adam, thank you.
Thank you. Appreciate it.
All right. Okay, that concludes our budget presentations for this evening. The next council meeting, we will do all of the rest of the departments. So it will be quite lengthy, but some of them are very short, so it shouldn't take too long. So we'll move on now to council comments.
Yeah, I'll start out tonight. And I appreciate Kim. I haven't talked to you since the last meeting, but I do want, without going into full detail, I would like to see, and Russ, this will involve you, how we go about having the council, this insurance committee that we've been hearing about. I would like for the council to be involved with this insurance stuff. I mean, we're the elected officials. We control the money. We vote on the money, things like that. So some kind of ordinance for the city council to be the insurance committee. Not just, I know, Randy, you appointed me to that committee, but I think it needs to be a group effort with the elected officials of the city.
And that's fine. You know, you have to understand, you know, most people that work can't come during the day. And so it's a logistics thing, but whatever, whatever Russ can come up with, all right?
Something we can.
One of the things you might want to consider, though, is when you make public some parts of your information, like number of employees and what have you, your knowledge, the knowledge of what you have in the city is, as far as, you know, number of people, the cost of the expenses and the outlays and what have you that drive the cost of the insurance. When you make that public, that may be giving, and you may talk to Mr. Schwindeman about this, that may hurt some of your competitive advantage, meaning if they know what your cards are, you know, and maybe it won't, but just, it's not as simple as what you're saying. I mean, you could just have everybody come in, and instead of Mr. Schwindeman giving the presentation to the Insurance Commission, he gives the presentation to council. But you may not want, well, either way.
I guess my question would be, what's the difference if council has that information or if the committee of 13 has that information?
just like you say earlier, you know, we just get the number in March or April. We have no say of how much we're paying for insurance. I just think it needs to be back in control of the elected officials of Vienna.
Well, let me ask you this. I mean, I kind of misperceived something there. I think I might have missed something. What you were saying is simply that members of council, in addition to department heads and whomever might currently comprise that committee, it also include all members of council, correct? Yeah. Mayor made the point, of course, you know, those committees typically meet. I know I was on it last year, and you've got to have your ability to schedule. Is there anything that prevents everybody on council just simply being made aware and invited to the meeting?
Yes.
Okay.
Public meetings.
The only
can't do that.
Well, that's why I ask. Right.
Open meetings act.
The issue you have is your council's not able to engage in an actual discussion inside the closed, you know, outside of the public.
And I'll tell you something, Mike, that's something I've learned in 25 years of practice in law. Sometimes you don't understand the elegance of how things actually end up coming together and work right. And sometimes the light bulb just goes on. And I think this is kind of one of those circumstances where it's a balance. I don't think that the information, you know, that comes forward, like the competitive bids and so on, and I think whatever level of information anyone on council wants to see would be available, correct?
Yes.
And that's why I keep asking, you know, these kinds of questions, but I think, you know, because it's just like the presentation you did tonight was helpful, I think, to me. I think we need, you know, the balance not to violate that open meeting, to protect our competitive advantage, because this is a very competitive arena, and you know, and that's why I think that for health insurance, my question's about, you know, everything that city employees are doing to improve our rateability, participating in wellness, shopping on the portal, completing those pretty personal health questionnaires to improve the rates that we get. And then, as I understood, Kim, with respect to Mark's comment on PEIA, I think that the rate that he was talking about for the city of Parkersburg, as I understood him, is only one piece, and that there's other costs associated that maybe we weren't hearing about. Because, again, my takeaway, and we can ask him more specifically, is that actually if we looked at PEIA, we probably would not be in as competitive a situation as we are now. I may have misunderstood him, but that was kind of what I took away from that. So, you know, my thought is that we just, as far as the transparency of any information that's being considered, not just at the last minute, and I'm hoping also that when he talked about that 90 to 120 day window being open and not just 60 days anymore, because you've mentioned just how tight a crunch time we are in getting our quote right at the end of the budget, and I heard maybe that's going to improve too. So that transparency for council, I think, might be there.
Well, there's a couple things. On the window that you're referring to, Jim, in the past, we've had situations where some companies have said, we can't work within that window, so we won't quote you. Okay? It's just, if they can't gather the data that they need to make a cost analysis, they won't come. All right? So that sometimes is out of our control. The other thing that I think you have to understand, Mike, is health insurance, there's not a whole lot of leeway. When you look at the plans that we have and you see the recommendations that Mark comes back with, the things that you can adjust how much your employees contribute, you can adjust how much the deductibles are, and you can adjust some of whatever the coverages are. But there's not a lot of wiggle room with any of the policies. With a group of 80 people, it's not that attractive a group for some people to put in. But whatever the bids come in, you'll see the bids, okay? There are no secrets there. It's always written down. That information will be made. But we'll figure something out so that there's more involvement earlier in the system. How about that? All right? Mark is more than willing to come to council. He'll make a presentation. He'll do whatever that we need to do to make you all understand where these numbers come from, how they compare with the numbers from the years previous, and where we're at. Okay? And I'll also do one other thing. I'll call some of the cities around us and ask them, how do they do it? I have no idea how Parkersburg does it. Okay? So let me do that, and I'll get some more information. But we'll work through this, okay? Because if you just want information, that's easy. Okay?
I'm going to take it one step farther, Mike, and I don't mean to try to take it any farther than what you did, but I still have a question on, I mean, I understand that there's not a lot of wiggle room. I mean, I understand there's just a few things like, you're out of pocket, you're deductible, how much the employee pays, but that's got a huge effect on the premium. Those are the things we have no involvement in. Right. Those are the things that, you have your committee of 13. How do they make up their mind what the deductible is going to be? Who decides that? Do they vote on it? Do you have a meeting and somebody just says, this is what, how does that happen? And why are we not involved in that process?
Correct, yeah, there you go, that's the whole thing. We're not involved in this process whatsoever. We see the final numbers, but who's deciding what the copay is, what the deductible is? I know Kim was talking about, and I ran the numbers, and so, we're paying, and I'm not asking the big price increase for the, but, this has been going on since 1999 until we tackle it, because we're doing the same thing over and over every year, and it's not working. So why cannot we not look at it as a council? Because, no rates have increased since 1999, and we're talking about, and the person making $30 an hour is compared to the person making $10 an hour. They're paying the same. Why can't we go to percentage without getting into the details of this stuff? Make it a percentage so every year the city doesn't eat the cost or neither does the employee, because they know they're paying the same percent instead of this dollar amount. That's just an idea, but more council involvement somehow needs to be done, because I think the way we're doing now is not working.
Okay.
Agreed.
So, go ahead. Would it be an ordinance to have the council? It'll probably get voted down like everything else, 5-2, 4-3. But I want to make it.
You already have the authority to do that. You just have to ask for the information. You don't need an extra ordinance to do what you're doing. What has happened for years is council just approves the budget. If you want a clarification, ask the people that have the information for the clarification. But what I'm saying about the competitive advantage, and I don't know if that's the best way to say it, but it's kind of like a blind auction, right? The competitors don't know. They know what your specs are. They look at the thing. They look at that plate, that fancy plate or the silver set, and they put a value what they think the value is. But they don't know for sure. They have a good idea. They wouldn't be in the business if they didn't. But what they don't know for sure is what the other guy thinks the value of it is, right? So the idea is you put your spec out and you hope that you have an insurance company that will come in and give you the best dollar for what your spec is. So what I'm saying is when you're asking for all of this stuff to be made public, part of the things that you're asking to be made public are what the other potential bids are. Now, if the bidders know what the bids are going to be, they may just walk away. So all I'm saying is, yes, there is a way to ask. You have to be careful, and you can't come together as a group to discuss things, but you can ask your folks for information. You have to, but the part of having the information is digesting the information. You have to look at it and think about it. And
why can't we do that as a group like we're doing right here, even if it's in a special meeting, or put it on the agenda and make a decision as to what we want to go out to bid?
I think that's what I just stepped in a minute ago, the open meeting.
Yeah, the problem is the discussion part of it. You can be on the Open Meetings Act says that if you have a quorum of individuals that are there to take up an issue that is potentially something that could be voted on by the governing body or council at this point, then it has to be agended, it has to be noticed, it has to be made public, and the public has to have the ability to attend it. What you're asking for is the ability to negotiate or to discuss an item that you are going to be giving up about the only thing that you have to negotiate with, which is the fact that A and B don't know what each other want to pay for something. So is it possible? It's probably a little more pragmatic to get the information and look at it yourselves and maybe discuss it in another way, maybe in the form of an executive session, but ultimately that's the issue you're running up against.
It's like when you buy an automobile and you ask someone to go get you a new Chevrolet and you tell them that you want leather seats and you like a sunroof, okay? When Mark puts together his information to go out to all of the healthcare providers, that's where you ask, okay, we want a $4,000 deductible, and we want to do this, and we want to do that. And that's what you give him as information-wise to shop, okay? Whatever the market will bring. So when he comes back, he gives 3 or 4 different scenarios as if you do this, this is how it will affect your premium, okay? So it's not just one take it or leave it proposition. And always in the past, because of all the things that were provided, the people that sat on that committee make a recommendation based on Mark, because he knows all of the information that we don't know, okay? Based on his recommendation that this plan right here gives you the best bang for your buck. This one right here changes it and will lower it or raise it, whatever it is. And so that's the information that the people on the insurance committee look at and make a recommendation based on the information that he provides. Now, giving you that information, once he gets down to that final meeting or the next to last meeting, that's easy, okay? It's all on paper, all right? But these are just quotes that he's gotten from various companies where we've plugged in and said, okay, we want a V8 instead of a 6-cylinder. Well, it's going to add $1,500 to the cost of your Chevy, all right? And that's how the process works. It's nothing secret. And the fact that these 13 people sit in a room and listen to Mark explain why this company does it this way, they make a recommendation, okay? We could turn it over to Mark and say, you're the expert, please make a recommendation of what you think is the best plan for the city, okay?
So who decides the $30 for the individual, the 120 something? Who decides? That same committee decides what the employee share is. That committee right there, consisting of the 13 department heads, decides what their contribution is.
What the recommendation is, Mike, okay? There's nothing, I remember distinctly last year from the discussions that we had to start somewhere. Everybody, the cost had gone up, everybody has to contribute, okay? And so that was a starting point, all right? When we came out and we had the discussions, you could have bumped it to 50, you could have bumped it to 100, okay? That was the deal. We had to start somewhere because we obviously have to offset some of those cost increases. It's a simple thing. You put in there that you want X amount of dollars assigned to each employee, that's fine. But the discussion is, if you give an employee a $2 an hour pay raise, or let's make it $1 an hour for ease. If you give an employee $1 an hour pay raise, that gains him $2,080 on his salary. If you bump that insurance contribution to $100 per month, you've automatically eaten $1,200 of that $2,100 out. So you net it out, your employee got a $900 pay raise. Okay? Those are the numbers that are tossed around, trying to figure out what the best formula is for everybody. Okay? Obviously, the cost factor is the consideration for the city council to have to decide, and all of the other features that come into our plan are analyzed based on what the cost is. A dental plan, vision plan, those kind of things. Short-term disability, long-term disability. Those things there all add to the bottom line on that thing. But those things are very, very small numbers. They're not very expensive at all. Okay? But that's where that logic comes from. But when Mark comes back with the different scenarios, there are no secrets. Okay? It's a pick and choose menu. What do you want? Okay?
And again, one more time, who will make that, who will pick, who will choose? We'll be able to look at it, I appreciate that, but, it'll come back.
In the past, the committee has made a recommendation to be submitted with the budget. That is the process that we have used for as long as I've been part of it, okay? And I shouldn't say as long as I've been part of it. It's been that way since Mark Schwindeman came, because before Mark came, we did not have the ability to reach out to all the other carriers and get a quote. We did not have that option, all right? So the people that are on the committee review all the information that he brings, the discussion goes on about, what are we gonna do this year, how's that work? And then it makes a recommendation. That's how that goes into the budget process, all right? It's not set in stone, it's not a decision that's made, the decision is made when you vote on the budget. That's just the way the historical processes work.
Because I think when we were talking about getting away from this dollar amount and going with the percentage, so that'll benefit the employee. Say next year the rates go down, well, they're paying 7%, well, their portion goes down. If you stick with a number, it's not going to pan out. If you stick with a percentage, whether the insurance goes up or down, they're still going to be paying that percentage. Right now, it's between anywhere from 3 to 6% on everyone. If we come up with a percentage instead of this dollar amount, I think it'd be more conducive to controlling that, the fluctuating back and forth with the raise and lower of the insurance.
A percentage of what, Mike?
Like, of their
salary.
Yeah, there's premium, what a percentage of the premium. Like right now, the individual pays $30 for full coverage. Well, that's like 3% of what the city pays. City pays 97. Why can't we say it's a flat 5% for everyone? I don't know what the percentage is. I'm just saying percentage makes sense to me as compared to dollar amount, because I keep saying, if the insurance goes up next year, they pay a little more. If it goes down next year, they pay a little less. If you have a set percent, then...
I don't know that would work. That may be something you talk to Mr. Schwendeman about, because the price of medical care for me costs the same as it for anybody else who's a city employee. So if I got to go to the doctor every time doctor's visit, the bill is for $500. So if I make, whatever amount of money that would be less than $500 as part of my premium, there's a difference that has to be made up somewhere. So are you saying that well, I don't know that the percentage will work, because the costs are the same to each employee as far as the cost of the care.
Well, and the other thing too is, we're really early into this.
Maybe I misunderstand you.
Well, we're really early into this process, okay? If you want to think about, if everyone here wants to think about the option that Mike is saying about a percentage instead of a specified dollar amount, bring it back, let's discuss it, okay? You may have an idea that we can work into this thing that will be, of consideration. So we've got plenty of time. We don't even have any numbers yet, okay? We don't have a budget. We have nothing. We're simply discussing requests at this point. So if that's something, bring it to the table, Mike. We can talk about if council feels like we need to set a specified amount, or we need to raise that. We can discuss that, okay? Because we've got plenty of time until we get down to the final numbers. All right?
I've got one more point to share on this. I don't know how you can look, just like what Mark was saying, and anybody that's dealing with employee retention is talking about. You have to look at total compensation package. You can't just look at health insurance in a vacuum. So if you're looking at a position of our 80 employees, and I think our HR department has done some of these comparisons. Where are we? And those are available, and I know they've been sent to you and to me and to everybody on council. How does the city of Vienna rate, competitive-wise, in total compensation package? So to single out health insurance and start saying that, well, compared to the private sector, for example, our employees aren't paying enough, in deductibles, or our health savings account is somehow not right, okay? You can't, I'm not going to look at it that way. I know that any analysis of health insurance has to be an analysis of our total compensation for our employees, and relative to the same thing as what is always my evaluation is, are the services these employees providing the city of Vienna delivering the value in return for the fees and taxes those citizens are paying? And just as the mayor mentioned earlier, our city is rated third in the state in quality of life. That comes at a cost, all right? And I think that if you surveyed, and maybe we do that, our citizens, and say, are you satisfied with the services in exchange for what you pay to live in Vienna? I think the vast majority of our citizens would probably agree that it is a good value to live in the city of Vienna, based on our compensation to our employees, as well as what we invest in our services and equipment, police department, fire, whatever it might be. So I'm just telling you right now, that's my approach, is if any analysis of health insurance has to include total compensation to our employees.
I agree with you. I'll look at that study again. I know that was a wage analysis.
I think it was total compensation.
I didn't see, was it insurance included?
Yes.
I'll have to get back and look at it, because I didn't know it included insurance on that compensation thing.
Yeah, I think that, yeah, so, okay, well, that's my last comment.
But we're early, Mike. Whatever thoughts you have, you know, and if you'll take the time to send them to me, I will be glad to discuss it with Mark and get you an answer. But we're early. We've got time to tweak this however council chooses to do it.
All right, I'm going to blow the whistle on this and say we've probably reached the point where we've gone beyond council comment and are actually having an in-depth discussion on insurance issues.
We asked for this to be on the agenda and it didn't happen.
I
did ask for it to be on the agenda.
I don't control the agenda. But I'm just saying, I think we've hit the point where this is an issue that probably should be agended. So, I'd rather me throw the flag than somebody in Charleston throw the flag, so.
But you did bring up one. I sent an email asking this to be on the agenda, so I didn't want to be in closing comments, but I saw it didn't make it on there, so that's why I brought it in closing comments.
You know, with bringing in Mark Swindeman to discuss the insurance system from an expert's advantage, all you had to do is ask that question, Mike, and Mark would have talked about all the different things from an expert standpoint. So when we bring an expert in, that gives you every opportunity to question him at length.
This wasn't the Mark Swindeman question, it's the City of Vienna question, Randy. I'm asking about the city council being involved with the insurance. I had nothing to do with Mark Swindeman.
Yeah, but he represents 300 companies. He can tell you how other people make these recommendations, okay? I mean, he's got a vast amount of experience in all the areas in insurance, Mike. So, you know, there again, you know, if you want to do this as an agenda item, then we'll leave Mark out of it and we'll put insurance discussion.
I think we certainly need to do that because somebody's totally missing the whole point here.
Exactly.
Mike's point is, and I don't know how to make it any plainer.
Why don't you let Mike make his point then?
Okay, I'll make my point then.
I yield to
My point is this, and I've tried to bring it up about 3 times now, and I don't know how to make it any plainer. This council is not involved in any of the information that goes to the Schwindeman agency for a recommendation. All we get is the recommendation back to us, and based on that recommendation, you either vote on it during the budget or you don't. Last year, I did not vote on the budget. This year, with the rate we're going on the insurance, if we don't do something different, I won't vote for it this year. We need to have a decision based on the council's involvement with what is the out-of-pocket, what is the deductible, what is the employee share. Those are things we need to be involved in. And I understand what Russ is saying. We're negotiating and then we're voting. But you know what? I can go to my employees tomorrow and say, do you guys want, here's 4 options. Do you want $1? Do you want $2, $3, or a $4 an hour raise? Well, now what in the world do you think they're going to tell me? Well, sure, I want $1. No, wrong. They're going to say I want $4.
You may be surprised to hear, Roger, that, and I believe honestly that Amy will verify this. In the discussions that we've had with the employees, they're very cognizant of what the budget is, and they don't ask for the sky.
I've dealt with hundreds and hundreds of employees my whole career.
Well, okay, but when you have your discussions with your employees about insurance, how much input do you allow them to have?
None.
Yeah. Okay.
And they're very happy.
Really?
Absolutely.
What insurance? Well, never mind. I agree with Russ. We've gotten off point here. Okay. If you have issues that if any of you have issues that you want to see put in for discussion in the preliminary outreach of our insurance, please send those to me or send them to me, and then we will make sure that we at least get answers of where these come from. Okay? Contributions, those sorts of things. We'll go that route. All right. There will be a special council meeting on January the 30th at 8 o'clock in the morning. It'll only last about 5 minutes or so. We received 2 grants, 2 JAG grants, and so we have to authorize the acceptance of those grants so that we can get the paperwork back to them before the next council meeting. So we have to have a special council meeting. One grant was for $30,000, which we share with the city of Parkersburg, and the other one was $15,000 for our resource officer at Jackson Middle School. So that's the only item that will be on that 8 o'clock in the morning meeting, and so we'll get that over and go ahead and accept the grants that we've been awarded.
Mayor, I can share with you now, I will be out of town.
Yes, sir.
Yeah.
Yes. Okay, we need a quorum though, so
I mean, I could call in if necessary.
on that same, the resolution for the Equal Employment Opportunity Plan will also be on that. That's the thing that Tony prepares.
I could call in if necessary.
Oh, okay, fine, thank you, Jim, that, we may need you, okay? The next council meeting will be a special council meeting scheduled for February the 7th at 7 PM. And then we'll have our regular council meeting on February the 14th after that one, but we will continue on with our budget meetings until we get done. With that, meeting adjourned.
So you got one way you gotta go. I'm like,
It's more fun when you're not in it.
I don't know, maybe just be a person, I don't know what it was.
You are gonna be,
Oh, thank you. Yeah, it's got to go up. You have a nice evening.